Welcome to the Wellness Health Services Health Talks. March is the month where we celebrate the World Kidney Day, and because of this, we will be talking about the problems, health problems that affect the kidneys, and how we can prevent them, and also how we can prevent getting the complications of kidney diseases. So the World Kidney Day, the theme of this year is Kidney Health for All, and it will be celebrated on March 9th. So our first talk on kidney problems will be on acute kidney injury. Acute kidney injury is a condition whereby there is abrupt disruption of the kidney functions, leading to excessive retention of creatinine and urea, and this leads to decreased output in the urine. The causes of acute kidney injury can be classified into three main areas. One, we have the prerenal area, whereby the kidney compromise occur before you reach the level of the kidney. There is the renal and there is the postrenal area. Renal involves conditions that affect the kidney itself, and postrenal leads to medical condition leads to complications of excretion of urine. So in the prerenal area, this occurs due to decreased blood supply to the kidneys, and this can be due to different medical conditions, including heart failure with shock, liver failure. We have problems with the pancreas, where we have conditions like pancreatitis, sepsis with septic shock, and then the main issue is reduced blood supply to the kidney. We have conditions like vomiting, diarrhea, excessive blood loss, overdiuresis, which is can be medically induced due to excessive use of the drugs that encourage loss of fluids like furosemide. Then there is blood loss, victims of accident, acute medical conditions like ectopic pregnancy. We have patients who, for any reason, that get excessive volume loss, which leads to decreased supply of blood to the kidney. Then we have the renal causes of kidney failure. These are the conditions that affect the kidney itself. We have conditions like acute tubular necrosis, where there is injury and damage to the tubular functions of the kidney. And then we have conditions like glomerulonephritis, interstitial kidney diseases, and also vasculitis. Vasculitis are conditions that lead to complications of the blood vessels within the kidney tissue. Then we have postrenal causes of kidney failure. These are conditions that lead to impaired excretion of urine, and you can have strictures, you can have urethral stones, you can also have bladder stones, conditions like benign prostatic hypertrophy. So the main complications of kidney failure, there is excessive retention of creatinine due to impaired excretion by the kidney. So you have excessive retention of creatinine. You also have conditions where there is increased urea in the blood. You can have electrolyte imbalances leading to hypokalemia. You can also have fluid overload due to impaired secretions of fluid by the kidney. So usually for the diagnosis, there is an increase in the creatinine levels to more than 1.5 grams per deciliter, or an increase in the creatinine level by more than 1.5 of the baseline for the patients for a period of more than 6 hours. So the investigations that you can do is basic ultrasound, which will help you. Usually the ultrasound helps to rule out mostly the postrenal causes of kidney failure. It will tell you whether there is enlargement of the prostate, presence of stones in the kidneys. You can also have strictures in the ureters, so you have hydronephrosis, and it also help you see the size of the kidneys, because when the kidney size is affected, then reduction in the kidney size is a sign of chronic kidney disease. Then the ultrasound will also help you to see the echogenicity of the cortex of the kidneys. Then other tests that you can do is urinalysis, the simple urinalysis, including urine microscopy, culture and sensitivity. With the urinalysis, you look for white cell presence in the urine, whereby if you have infections of the urinary system, then you see increased white cell count in conditions like cystitis or pyelonephritis, which is infection of the kidneys. You look for red blood cast if you have tubular necrosis, presence of proteins in the urine, and if there is if you don't get the diagnosis after doing urinalysis, then of course there's the urea electrolytes, which will help you know the extent of the kidney damage. And then also there might be need for doing kidney biopsy. The treatment mainly is guided by the cause. For prerenal causes, which is the commonest cause of kidney failure, there is problems with volume. And these are patients who have acute conditions like diarrhea, vomiting, conditions like uncontrolled blood sugar. And the mainstay of management is hydration, where you give the patients adequate hydration so that you control and collect the fluid deficits. If they are losing blood actively, then active management of the cause of bleeding, then that should help to prevent the kidney failure. Then for the kidney causes of renal failure, it's trying to remove the causes that are causing the kidney injury. Many of them, as I said, is prerenal causes. Then you also have toxins, and also sometimes drugs like non-steroidal anti-inflammatory drugs, which can lead to kidney damage. Then, of course, control and treatment of the acute conditions like diabetic ketoacidosis, electrolyte imbalances. And for post-renal causes of kidney failure, the main issue here is relieving the urine obstruction. If there is a BPS, sometimes catheterization to relieve the urine flow. Then you can also have the presence of kidney stones, whereby you may, depending on the size of the stones, then removal of the stones or hydration of the patient as you give time to the obstruction to the kidney to relieve, of the stones to relieve. Presence of strictures, then those might need surgical interventions like nephrostomy, where you put the urethral tubes to try to relieve the urine obstruction. Of course, you also have conditions like cancers, especially cervix. You have also prostate cancer, which can lead to urine obstruction, and then the management will be dependent on treating the primary cause of the obstruction. Indications of dialysis or renal replacement therapy includes in the acute states the presence of acidosis, electrolyte imbalance, especially hyperkalemia if the potassium level goes more than 6.5 milligrams per deciliter. If there is a fluid overload leading to pulmonary edema, respiratory distress, in such circumstances, then there is need for kidney replacement therapy. And then also presence of uremia, which can lead to many complications, including encephalopathy, altered mental status. And in the renal replacement therapy, you can do hemodialysis or peritoneal dialysis. So for acute kidney injury, this is abrupt destruction of the functioning of the kidney, which is often caused by acute conditions. Commonly, the prerenal causes of especially leading to decreased supply of blood to the kidneys and leading to impairments. and this can also lead to impaired kidney functions and extraction of renal tissue, and this can be controlled by aggressive fluid management. And then when there are indications for renal replacement therapy, then timely replacement therapy. Thank you very much. Let's all keep our kidneys healthy.